Guys, this is Carol. She's going to show you how to do a renal biopsy using the proper patient prep, proper tools, and proper aseptic technique. First, she's going to put the blanket on the bed, making sure not to touch the floor with it or else she'll have to get a new one. Then she will put the patient information into the machine, and then she will put on her mask and her surgical cap. And now she will show you how to open the sterile field without touching the inside. So this is the stuff that we need for it. We need a sterile field, which Carol opened for you. They say that you want at least 2 to cover the table. This is a transducer cover, scalpel. This is the Band-Aid for after. And then we need a 10 cc syringe. We need a 16 gauge needle and a 25 gauge needle. This here is, it's called DuraPrep. It's what cleans the area of where they're gonna puncture and get the tissue from. This here is the biopsy gun. The norm that they usually use is the 1810, and that's what this is. Sometimes they use a 16. This here is a needle box. You put the you open it up and you put the scalpel in here as well as the needles when before and after you use them. And then you've got the gauze and the Band-Aid. So the way we open these things is you have to make sure that you do not touch what the sterile part is. So she's going to grab it from the white piece that's covering it and drop it on the sterile field. And you do that for all of these items. You don't want to touch them or else they're not sterile anymore. We just opened one for an example. So Carol has her table set up with the proper equipment. Now she can't touch any of this unless she puts on sterile gloves. And in the meantime, she will prep the patient. So she will put on regular gloves. Now, after she puts on gloves, she will put the patient in prone position, and then we would put the pillow underneath the patient. And then Carol would also take images evaluating the kidney before the biopsy is performed. So continuing to prep the patient, Carol will put on sterile gloves. You have to be sure that you do not touch the inside of the paper or the outside of the gloves because they're sterile. See where her fingers are touching is where she's only allowed to touch. Then you cuff the other side from the inside. And now she's sterile. So then Carol is going to open the probe cover. So you want to be sure that there's gel on the probe cover before you put it, on the probe before you put the cover on. So you rubber band it. And then you want to smooth out all the gel, so all the bubbles, you want to smooth it out, make sure it's nice and smooth. And then you slip it through this piece of plastic and pull it down past the head. And then you want to cover the cord. And then you rubber band it again. And then you'll place it on the sterile table. And then Carol is going to clean the site of entry. You use this thing, you squeeze it and you shake it to get it all mixed up, and then you use it to clean the patient. After you clean the patient, you use these sterile towels to drape the patient. Also, if you have a doctor that likes for tools to be handed to him, you need to be sterile at all times. So then the doctor will give the local anesthesia with ultrasound guidance, and after that, the sonographer will actually take images of the needle, or actually the needle biopsy gun entering the tissue and taking the sample. If the tissue isn't good enough after the pathologist evaluates it, then there have to be a pass 2, pass 3, pass 4, etc. Then after all the passes are complete, the sonographer will actually take a post image of the kidney. So after the passes are complete, Carol will clean the table, clean the patient, and take him or her back to short stay.